Not allowing me to start the recording. Oh, there we go. All right. Okay, let's go ahead and flip to the next slide. Some reminders. We do ask you to please mute your mic unless you're speaking during questions at the end of each presentation. We do have the slide set posted on the caregiver supports and community information site. The link is in your invitation. You just need to scroll down to the community forum section and you'll see it listed there under July 12th. There will be time for questions at the end of each topic. If you have questions during the presentation, go ahead and type them into chat, or you can hold your questions and unmute yourself when we have time at the end of the presentation. But our preference is that you do use chat to ask your questions so that we make sure that we have all of them in case there isn't time to answer all the questions. Okay, and we are recording this, so if you prefer not to be included in that, you can go ahead and turn your video off. Next slide, please. Here's our agenda for today. We have our welcome and reminders, which we're doing right now. That will be followed by a county self-assessment / system improvement plan update by Don Long and Damian Wright. We will then go to Family First Prevention Services with Rocio Abundis and Wendy Kinnear. Then program build-outs with the budget by Daniel Little. Then we have a short time for Q&A and then our wrap-up. Let's go ahead and, I'm going to have the directors go ahead and do their welcome and introduction. So Dan, let's go ahead and start with you.
Yeah, thanks, Nora. Good afternoon, everyone. I'm Daniel Little, I'm the Director of Department of Family and Children Services. So thanks for taking time out of your busy days to join. Very excited to see so many of our partners and stakeholders able to kind of listen to the work that's happening within DFCS. As Nora had mentioned, this is our second one of these kind of revised community forums where we have an opportunity to share the work happening within DFCS. I think within child welfare and child protection nationally, I think there's a lot of changes, there's a lot of new opportunities. And I think it's exciting that we're able to share some of the work happening and be able to answer questions directly. So again, hope that everybody finds this beneficial and just thanks for joining. And with that, I'll turn it over to Damien and Wendy.
My name is Wendy Kinnear-Rash. I'm one of the assistant directors with Department of Family and Children Services for prevention and programs, and happy to be here today to share some happenings that are occurring within Santa Clara County. And as Dan said, happy to see so many of both staff and community around this virtual square.
Damien.
I'm sorry, Nora, did you want me to do something or?
Just introduce yourself.
Oh, okay. Damian Wright, one of the assistant directors, Department of Family and Children Services. Glad to see everybody.
All right, thank you. Okay, next slide. We're going to move right in. So next we have the CSA and SIP update. So with that, I will turn it over to Don Long.
Morning, everyone. Don Long with the DFCS. Nora, next slide, please. So this is just a quick update on the county self-assessment as well as updates on the system improvement plan. The CSA will be informing our SIP, but it's also undergoing a lot of revisions and updates right now. But about 4 or 5 months ago, we had a number of interviews, stakeholder interviews, case reviews, and work in that area. And these are just a quick highlight regarding our strengths and opportunities that were identified. As a background, the case reviews, we're looking at the case period of 2017 through 2021, and with a focus on our CSFR indicators, focusing on P1, which is permanency within 12 months for children, P2, permanency within up to 24 months, as well as a P4 with re-entry into foster care within 12 months of exiting foster care. So as you can see, some of the strengths that we identified was that Santa Clara County has an array of family engagement tools. We use a lot of CFTs throughout most decision points, as well as initial assessments using our CANs, SDMs, family finding, and identification and so forth. There's also a lot of emphasis that we place on relative and finding placements and transitional services within our continuum, chiefly moving from, through a sit-down model from most intrusive to least intrusive, right? And also providing families an opportunity to continue receiving services throughout voluntary family services before moving on to differential response and so forth. And compared to other counties, we also have a much lower caseload compared to many others, which allows many of our social workers to engage families more intentionally and with more time to work with families. Areas of opportunity included communication, because we have so much going on, including our contracts and everything going on with our partners. Communication is an area of constant improvement. There are also challenges with placing out of county. As we all know, Santa Clara County is extremely expensive to live in, and don't always have the luxury of having many placements in. Well, most of our places are in county. There are some that are out of county, and and that presents challenges with both travel and engagement with kids and other stakeholders, and also just better resource coordination. Again, I mentioned we have a lot of resources, but better communication is always needed, and also opportunities to provide additional training to hone in on those culturally relevant areas that are important to our families. And also additional aftercare services through the community, just building up more of our community services and so forth. And thank you, Wendy, for going over the acronyms that we have. So our CAN stands for Child Adolescent Needs and Strengths Assessment. SDM is our structured decision making. Sorry for the typo there. And then CFTs is our Child Family Team Meeting. With that, I'll kick back to Nora.
All right. Thank you. Let's move to the next agenda item, which is our Family First Prevention Services Act. That's we call that the FFPSA. And with that, I will hand it off to Rocio and Wendy.
And I'm going to get us started, and hopefully, I know there's more alphabet soup to come, so I will do my best to not use acronyms or spell them out. So I get to start us off on the Families First Prevention Services Act, which I think is a great opportunity for this county. And I emphasize the county. This is not a DFCS effort alone, but it needs to include all of our partners to be able to support our families in the best possible way. Next slide. So California has a vision specifically for FFPSA, which very much aligns with our vision here in the county, and that is to make sure that we have a system in place that supports our families to be safe, stable, and have nurturing relationships and environments for their children. And the only way we can do that is by partnering across multiple systems and avoiding silos. We cannot do things independently because families don't live in DFCS alone. Families don't live in education alone or probation alone. They're families, they live in community, and we have to work together to support them in the best possible way. Next slide. And what we need to do to accomplish that is we need to shift our mindset, and we are already doing that. We're shifting our mindset from a proactive approach to a reactive approach to a proactive approach, really being more preventative and thinking about how we support family in community where they live. And that brings me to the social determinants of health. That is very important because families live in a community and they're impacted by a lot of variables, whether or not they have access to quality education, are their kids able to attend preschool and setting them off to a good education? Do they have access to healthcare, quality healthcare? What are the neighborhoods like, and what are the influential factors in their neighborhoods? Are they safe neighborhoods? What economic supports they have or not have? As Don said, this is a challenging community. We have a large homeless population and a lot of poverty. So those are all things that have to be factored. And what other social community things are happening that affects these families? So long story short, whole family, whole child, whole community, you have to look at them in the context of the community and where they live. We also want to make sure that we shift our mindset to equity and make sure that we have community voice in every possible way. And you're going to hear that community voice theme throughout. Next slide. Now, FFPSA, the Families First Prevention Services, is really looking at the whole range of prevention. While it's funding primarily secondary and primary prevention strategies, they really want us to look at the whole spectrum of primary to tertiary, which is why it's really important to have a collaborative approach. The primary prevention approach is really about providing services and education to the community as a whole. It's a public health approach for being preventative. Secondary is oops. Oh, son, I heard an echo. Secondary is really serving families where we already know that there's an identified problem and we focus on them to help support them. And then tertiary is they're already in the system. They've already experienced some form of abuse. And then our services are to support them. So it's really more reactive. But we want to make sure that we have the whole range, again, to serve the diverse needs of our community and all of the supports that they need. Next slide. So how will California achieve this vision? So as I mentioned already, the full spectrum of primary, secondary, and tertiary, we will be responsible for developing a plan. And when I say we, that means all of the system partners, probation, behavioral health, Department of Family and Children's Services, County Office of Education, community-based organizations, and so forth. We're going to collectively develop a plan on how Santa Clara County will meet this vision. And it has to be the full spectrum of primary, secondary, and tertiary. We want to make sure that we engage the community in identifying their needs. Their needs should be driven by them and not by us, although we also have data that we will be able to look at to identify needs. We want to make sure that anything we create is rooted in the frameworks of equity. And that we're truly integrating all that is happening. There is so much happening in this county, which is a positive, but it can become a negative if we're not collaborating together. So it's not about rebuilding all over again, but taking a full advantage of what's already occurring in our county and partnering with each other. And again, it's about looking at our models holistically and making sure that we're serving the whole child, the whole family in the community. Next slide. So diversity, equity, inclusion is mission critical. We can't plan services that don't meet our families' unique needs. So we want to make sure that, first of all, we have family voice at the table. So they're helping us understand what best ways can we serve them. One of the things about FFPSA is they do require that our programs are evidence-based programs. And there is a current list of federally approved evidence-based programs. So we will have to pick and choose from those programs. However, that doesn't rule out other programs that are not evidence-based. And so our job will be to help them become evidence-based, but also to make sure that they meet diverse needs of our community. We're going to create a governance structure that supports equity and cultural responsiveness. And we already have some structures that we can tap into and build off of. We want to make sure that we engage our tribes in this process and lift up their voice as well. And that we address any system barriers. There's always a lot of system barriers, and how do we address those to best support our families? We also want to make sure that we tap into what we are already doing. The integrated core practice model or the child family practice model, they're both very similar. And the essence of that model is authentic engagement with both community and our families that we serve. And most importantly, how do we create a community pathway to deliver these services? And what I mean by that is FFPSA will be offering services, but it's not just for families in child welfare. It could be for families in community. So there's different ways of them entering into getting those services. Next slide. So our approach is really simple. We want to make sure that we reduce risk factors and increase protective factors. And so when I talk about risk factors, many of you may have heard about adverse childhood experiences. So these are risk factors. These are things that may be occurring in a person's life and increases their risk, such as homelessness. Maybe a child is in a household where drug use is prominent. There could be mental illness in the home. Those are all risk factors. It makes them more likely to experience a problem. So we want to reduce that and increase protective factors. And when we talk about protective factors, those are the things that will help them address risk. So it could be stress management skills. It could be increasing their resiliency. It could be making sure that they have concrete supports, that they have diapers, and that they have a crib, and that they have food on the table and a shelter over their head, and that they have the social connections that are necessary for them to have the support that they need. Next slide. I talked about collaboration, and this is mission critical. The very first slide I mentioned about we cannot be siloed. And so the only way to eliminate those silos is by collaborating with others. We want to make sure that we work very closely with them to address all the things that I've already talked about, that we have a good understanding of the strengths and the needs of each of the communities. There are already a lot of needs assessments done, and so we will pull those together and look at them and see what trends there are, but we may also reach out and try to get some more data from community. That may come from having voices at the table of people with lived experience. And we want to make sure that we have alignment and coordination so that we are building on what currently exists and not reinventing the wheel. Slide. And so here's an example of who some of the partners are. I don't really like the required partners and recommended partners. These are all partners that we should be engaging, and many of them are already engaged. And I'm not going to read them out because I think you can see them, but the point of this slide is there's a lot of players out in the community that should be at the table. And if you are interested, I'm more than willing to talk to you offline. You can always leave your information in the chat and we can engage you and see how you might be able to participate. And I will pass the baton to Wendy for the next slide.
Thank you, Rocio. Next slide, Ariel. So next, we're just going to give you a little bit more of a framework for this shift within child welfare and this exciting opportunity that we have. And just to highlight a bit further on this, this is federal funding, federal initiative. California has opted in, and Santa Clara County as a joint opt-in between child welfare and probation have opted in. So just a little bit more, and you may hear terms used such as Part 1 and Part 4. Part 1 refers to all of those prevention, primary, secondary, and tertiary services. Part 4, if you hear Part 4, really refers to those youth who are in either probation or child welfare that are our highest needs youth that are in residential treatment programs and provide some requirements for us as a child welfare and probation agency. So just a little bit more about Part 1. This is a reimbursement for particular services. It's really going to be concentrating. California has chosen to concentrate on mental health, substance abuse treatment, and in-home parenting skills. Those candidates for prevention will be both children at imminent risk of entering foster care and their family members. And as Rocio pointed out, there will be a community pathway as well. The overall goals for all of us is to decrease the number of children who are in foster care, to increase those kinship supports for caregivers, and to increase overall child well-being. Next slide. So California's candidates. So California has developed a 5-year plan, and these are the candidates that California would like to see us focusing in on. And I'm just going to popcorn around to lift up some of these. So it will be children who are already involved in the child welfare system, either from a voluntary basis or a court basis. Probation youth who fall underneath the Welfare and Institution Code 602. Children who have had a guardianship or adoption developed over time with either relatives or non-relatives and have worries or concerns bubbling up for them. Children who are homeless or runaway, children who identify or youth who identify as LGBTQ, are substance exposed newborns, children who have siblings in foster care who are either determined to be at risk or who aren't at risk but are connected to that family system. Children or youth who may be trafficked, children or youth who may be exposed to domestic violence, children whose caregivers may be experiencing a substance abuse disorder. And then as lifted up, children who are connected to any of our Indigenous populations and tribal youth or any of our pregnant and parenting. Next slide. So eligible services I lifted up. So the prevention services need to be trauma informed. And as I said, California's initial landing spot is they want to make sure these are focused in on mental health services, either individual or family therapy, connection with substance abuse services, and in-home parenting skill-based programs, whether parenting training or home visitation. Next slide. Options of pathways. So just want to be really clear, there's 2 different pathways when it comes to preventative services. The Title IV-E pathway are those that are as Rocio lifted up, the secondary or tertiary intervention. So they are going to be families who traditionally have come to the attention of child welfare, either through voluntary or court-ordered services, referrals that come directly to the hotline, and then those aftercare services for families, whether it's a guardianship, adoption, kin gap, and improving the way we work with those families, support those families. And by families, I'm talking about children and youth, parents, and caregivers, however caregivers are defined. And then there is a community pathway. So the community pathway is going as far upstream as we possibly can. Referrals can come from community, family, or hotlines that don't necessarily meet the criteria for an investigation or even after an investigation has occurred. Services will be voluntary and engagement strategies will be used in order to engage those families into services. Is really aimed towards reducing the stigma associated with child welfare involvement. And as Rocio lifted up, this really is at the heart of reducing disproportionality and supporting our communities of color, as well as reducing families that have been involved in the child welfare system. Next. This is just another visual of the primary, secondary, and tertiary. And just as a reminder, that primary is really how far upstream can we afford? How far can we go upstream to make sure families and children have what they need so they don't even come to the attention of the child welfare or the probation system? And then your secondary and tertiary are really those families that have already come to the attention of the child welfare system or exiting out of the child welfare system. And how do we make sure they have everything they need and are more robust to address any needs or worries or concerns that have bubbled up for them? And then really it is about how we are leveraging Title IV dollars to really boost the entire continuum. So as Rocio said, this is to build out as far and wide as possible in support with community. Next slide. So this next slide is just to give you an idea of what already exists within Department of Family and Children's Services right now within the DFCS prevention continuum and how they fall into the buckets of primary, secondary, and tertiary, and how some of those interventions actually go across families in each of those different areas. So you will see at the top, DR is our differential response pathway. The prevention pathway is upstream with schools partnering before families even come to the attention of child welfare. Our differential response, early intervention, and diversion is really those families that come to our attention right at the emergency response level in order to divert them from entering further into the system. And then we have differential response aftercare, post-adoption, and guardianship, really working with those caregivers after cases close to make sure families are connected to and tethered to the communities in the way that makes sense for them. So again, this is just to show you some of the repertoire of services that exist within the department right now, how Santa Clara County has been fortunate that we've already leveraged services, and then FFPSA will allow us to take that to the next slide. So where is Santa Clara County to date for the Family Services Prevention Act, and where are we going? So we have opted into what's called Families First Transition Act funding that will help leverage this federal dollar. So we have opted in to be able to use that funding. The state, California, has opted into this federal resource of the Families First Services Prevention Act. And as mentioned, Santa Clara County has jointly opted into FFPSA as a child welfare and probation entity. As I alluded to, our Part 4 has been in effect since October of 2021. And one of the things I should note is that the Part 4 having to do with those children who are in high-level residential treatment programs and making sure their care is coordinated and that we have consistent services in place and what's referred to as a qualified individual, a neutral person doing an assessment for that, that is a requirement for all counties. There is not an opt-in. That was mandatory for all counties and was put in place on October of 2021. The prevention part of this act is a opt-in or a choice by counties to opt in. And right now it looks like the vast majority of California counties are opting in. So as Rocio alluded to, we have meetings and planning for FFPSA in process right now. Our 3-year plan will be due in January of 2023. And we are in the process of collecting feedback and really calling out that we absolutely need to make sure we are co-designing with lived experience and partnership with community, parents, youth, and Native American tribes within Santa Clara County. Next slide. This is a bit of a visual and a roadmap of where we are to date. Down on the bottom, you'll see on the far left is less ready, and we want to get to more ready by January of 2023 with our initial 3-year plan for Santa Clara County. I'll lift up items that Rocio had called out as well. There's been the release of the ACL. We have opted in, and we are now at the point of, in the middle of your screen, you'll see about asset mapping, needs assessment, reviewing the data, considering what evidence practices are available within Santa Clara County and those we want to adopt, and doing more of a readiness assessment. We are in the process of inviting more partners to the table to roll up their sleeves and to do this work in a shared space. Some of you with organizations may have received a survey around what evidence-based practices are occurring right now. Some of you may have received a survey about some needs assessment and mapping within your organizations. So all of that is in process right now. And then the hope will be that we have a comprehensive plan put in place by January of 2023 to move that work forward, knowing that that plan will need to be revised and revisited. And I would look at this as this really is the shift of changing the way child welfare looks, changing the way we work with children and families in community and in partnership. And it's an exciting opportunity for us to leverage funding differently. Next slide. So, for many of you, this may have been the first time hearing this. So, Nora, I know that we have a little bit of time to entertain possibly some questions, and we'll take a look at chat as well.
All right, we do have questions in the chat. So Wendy and Rocio, if you can look at those and maybe identify the ones that you'd like to talk about out loud. And for anyone else interested in asking a question, you can enter it into chat or you can raise your hand at this time.
Questions from Chris about, does enrolling in the community pathway put families at risk of having child removed from their care? So the answer to that is no, but I will answer that transparently that there's been some questions about child welfare will still need to sign up on the billing for those families on an upfront pathway. But the hope is that we move up front, and it is just a matter of getting the funds to community-based organizations for that community pathway. So the hope is that we prevent families from coming in contact with child welfare. So there should not be a risk of them coming to our attention. Damien answered that a bit. Lifting up our DEBS, Department of Employment and Benefits, are part of all of this initiative and this work. And there has been some communication in chat about AB 2083. Nora, we may want to bring back some information on AB 2083, which is a mandate for all counties in California in order to develop an operational manual and to work in collaboration. Your 5 main mandated partners is Child Welfare Probation, Behavioral Health, County Office of Education, and Regional Center. And that will be linked with some of this work that all of us as county entities need to make sure that we are aligning services and working in collaboration to, at the end of the day, support children and families. And thank you, Damien, for putting that in chat. Will the draft plans be shared with agency affinity groups and REAL team members? By Raul, yes, and they should be. REAL has been invited to the table for these, and that they absolutely should be at the table in partnership and in collaboration with this work. And then is there a summary of the efforts we can read through? Yes, we can put a link to the ACL and some additional information for those on. Lucio, did I miss anything?
Sorry, I couldn't unmute myself. You did not miss anything, but I did want to say that there were 2 individuals that wanted to be included in the invitation, so they've already been added.
There's a new question in chat. Is there a plan to partner with DAC's corridor program?
Do not believe they are at the table right now, but we are at the point of taking inventory of who is at the table, who is not. We do have DAC at the table. I'm not sure that specific program has been called out, but we can make sure that's put on it.
All right, Elizabeth has her hand up. Elizabeth, you're on mute.
Sorry, having my own conversation here. Wendy or Rocio, have we connected with any tribes as of yet?
So in Santa Clara County, we do not have tribes that are in this community. However, we sit on tribal land. So we are inviting to the table those that are linked in, working with Indigenous persons in Santa Clara County in connection with multiple other tribes. So that voice is at the table. So that is where we're at to date on that.
Okay, I will send you an email with more information.
Perfect. And I'm going to drop in chat some of the connected resources around this work within child welfare and connections to the Families First transition work and others, so that you have the resources. Yeah.
Any other questions? All right. Thank you for the FFPSA update. Let's go ahead and move to the next agenda item. Next slide, please. Daniel will talk about this one.
Yeah, thank you. So thanks, Rocio and Wendy, and for everybody asking questions. So I'm going to be brief to allow room for some questions. So we can go to the next slide. Really excited and happy to report that DFCS received all of the positions we requested in the budget. So 93 total positions were added to this current fiscal year. You can see 50 of those positions are between our social worker 2-3s, which are the majority are going to be related to direct client work as well as supervisors. And the additional positions are really related to supporting key program areas. So building out prevention, some of the work around family finding and placement. So just again, very excited that we were able to continue to build out DFCS and continue to the work that we're doing with children and families. If you want to go to the next slide, we go over some of the programs. So you can see the 93 positions are spread really across almost the entire department, from adoptions to after hours to family finding and prevention, visitation, emergency response. So really a recognition from both local, the county, as well as the state. A lot of this was based on the state increasing funding to counties to be able to onboard more staff. And the recognition that much of the work that we do is based on relationship and it's based on engagement with children and families. So again, very excited to continue to see us build out. I think we discussed last time that over the last year, we have seen a decrease in the number of families coming into the formal child welfare system, so the foster care system. And as Wendy and Rocio have outlined, we have a lot more resources dedicated towards prevention. Nora, can we find who has an open mic, I think?
I'm sorry?
I think somebody may have an open mic. So very exciting that we're seeing with a decrease in the number of children coming into foster care, that we're still able to increase the number of staff that we have to engage with families, especially on that front end, especially during emergency response. And the other piece I'll add, because we've received some questions about this, that's not related specifically to staff, but we're continuing to build out the services and supports that we have available through formal contracts. So, as Rocio and Wendy have outlined, there's going to be significant opportunity over the next several years through FFPSA to build out that formal prevention continuum. We're still continuing to build out the services available within DFCS, so families that are served within DFCS that, any awards of contracts, we're really looking at historic utilization, but our goal is to make sure that services are available readily and they're available in families' communities. And when possible, available to families not through foster care. So making sure we have service and supports available to families, really at that first point of contact for us, and then really in the community before we see the trauma impacting children and families. So again, really excited to see that our budget request was approved. And I guess with that, Nora, I'll pause and see if anybody has any specific questions. Yeah, Marianne, good question about expansion, neighbor to neighbor, DR, Path Zero. So I think that there is some work to look at what can be expanded. What we're running into now with is capacity with a lot of our providers, and I know that that's something that the system is working on as we shift towards more prevention efforts. So there is going to be some discussion about expansion, but we want to make sure it's thoughtful with neighbor to neighbor being a pilot program. We really want to make sure that we're partnering with the Family Resource Center that's doing that pilot and learning from what they're seeing and what they need to be successful and building it into any future expansion. So I would anticipate that we are going to see expansions in the future, but I think the time frame is still kind of up in the air as we kind of work through that process with our partners. I don't see any other questions. Okay, I think we can probably progress.
All right. Okay, so now we open this up for anyone who has some questions. We did have a link out if anyone wanted to pre-submit questions, but there were none pre-submitted for this one, this community forum. So opening it up now, if you have a question, feel free to put it in chat or go ahead and raise your hand.
Maybe I'll just, as we wait for any questions, just add a quick update for our partners. Those of you that haven't heard, Bob Menicucci, who's been the social services director for many years, is moving out east. And his last official day is going to be this Friday. Deborah Portia Usher, who's been the deputy director at social services, will be moving into the acting role. Sandra Hermone, who's been the deputy director over the Office of Research and Evaluation, will be moving in to cover the deputy director position while they're going through the formal recruitment for the agency director position. So I would anticipate seeing more news on that end later this summer, probably on the recruitment piece.
Tony?
Yeah, Tony Cuevas, Division Manager, SSPM2 South County. And I think some things that are important, Daniel and Wendy and Damien, in intersecting with community who have historically helped us with families in the community, is that, and it's sort of unknown, I think, in the community what the impact is of our family preservation model. But already in-house, there's been a sharp reduction, as Daniel has said, as it relates to, folks involved with court. And as we know, for families of color, once you're in the system, it's really hard to get out. And that reduction also impacts disproportionality, as Wendy touched on. But what does that really mean? And what it means is there's less African American and Latino children in the system, which is a great thing. And let's see, aside from that, I think the shift towards a prevention model really is going to have to be supported from community. And it moves away from the stigma of, involved with a system. And I think the other point is just the poor outcomes that children in foster care or long-term care have. And so a reduction in kids coming in, we move away from that, system that basically raises children and does a poor job. So the other component that I think is very important as it relates to the department is the identification of race and equity. So we have a team called the Real Team, and it really highlights the importance of the institution as a whole working on making changes to move away from any institutional bias. Part of that is the disproportionality, but also, looking at how we hire into the workforce in Santa Clara County. So really significant changes for those that have been around. I've been around 22 years, kind of hammering some of this agenda, and it's really nice to see the department shift. So if the community can join us as we totally change the system, I think it's great.
Thank you, Tony, for that. I think that that's so important, that, you know, as the county's child welfare agency, we absolutely have our specific mandates and our vision and our direction. And I think our staff have done an incredible job in how we are engaging individual children and families. I think to your point, we've seen a significant reduction in the number of children who are being separated from their families and from their communities. When we dig into the data and look at of the children who are still removed, you know, who are they? We still see that disproportionality piece. And I think that's where we start intersecting with the work that's happening out within the broader community. You know, that's why I'm just so excited to see so many people here that have such important roles, formally and informally, within the leadership of different agencies and within the community, that this really is a community-wide effort. And, you know, as Tony had said, there's many people on this call that have been working at this and with this for many, many years. And I think it's good to see some things. We're seeing some really measurable improvement in other areas. We're really identifying kind of some really tangible next steps. So thanks, Tony.
Daniel or Wendy, have we, or Damien, have we thought about different vehicles or ways we want to engage community? So this is one platform. Have we thought about other, and then we have the FFPSA, that's, you know, to get some feedback and have community at the table. Are there any other outside of the box ideas on how to build relationship, continue to strengthen and build relationship with community?
I'll let Wendy and Dan add to this, but Elizabeth, I know that there is some, well, first I'll say, I know Rocio oversees a few groups, whether it's the Children of Color group and another group, I can't think of the name, that actually has a lot of community partner representation. But we're also, to your point about creative or out of the box thinking, we are looking at how to, one, look at engaging community in a very specific way, as well as looking at some regional kind of work that we can focus in on for community partner engagement. But I'll turn it over to Wendy.
I'll add a few other things and definitely lean into Rocio as well. I would just add that that's part of what's occurring right now, is making sure anything that's existing right now, how are we taking inventory of what exists, where are those gaps, how do we reach out to those that are most disenfranchised or benefit from this, how do we hear from a community voice. And at the end of the day, right, hopefully what you heard today is co-design lived experience from communities, parents, youth, and absolutely for us, that includes the disproportionality for those in our Latinx community and our Black, African American, African ancestry, as well as for our Indigenous persons. Even though we may not have federally recognized tribes, we are on Indigenous lands and absolutely have to make sure they're at the table. So it is a both and. There are things that are occurring right now. How do we enhance those further? How do we build out further? How do we make sure we don't have any gaps? And how is it built in a wraparound plan that if this is not a one and done, this is about building out how we're doing this work and continuing to move in this path. So as you said, Elizabeth, how do we build those relationships and put those in the driver's seat that can help support this work and allow them to lead this work? Rocio, I'll pass to you for any other thoughts.
Yeah, I don't think I have anything else to add. And to clarify, the other you were referring to with the multicultural community team. Sorry, I've been having technical issues during this webinar.
And I'll just add too, I think that there's a need for very specific engagement around items like our system improvement plan, around the Families First plan. I also think that we need to get back to some of our general outreach and general engagement within the community. I also know that when we were talking about building a service or an array of services, and Rocio, I think, has really been a champion of this, trying to avoid the pitfalls that I think we often see, we as in the formal, like child welfare of we know what we want for a service and we're gonna then ask for it versus going to the community and saying, what is your need? What do you want to provide and how can we support you in that endeavor? So I think we'll see more of that as well.
Kathleen?
So I always remember what Cindy Chavez says to me, which is if we can help the most vulnerable, we can help all. And so I am a big one for individualized care coordination that is culturally sensitive and is a language that the family's comfortable with. But I think if we don't individually help the families that are having the toughest time, it just gets worse. So I don't know how you're going to go about that, but
You're back. You're on mute.
You went on
Kathleen.
mute, Kathleen.
sorry about that. I'm not as good on Teams. But I don't know where I went on mute, but I think having worked with foster families, there's a lot of issues in the health area that are difficult to deal with fee for service. So I am just going to recommend high individualized care coordination for families that is culturally appropriate for their family. Thanks.
Yeah, absolutely agree, Kathleen. And I know that we've looked at some of the ways that our work overlaps, and I think I've developed a really good partnership. And the idea of what can we do, because it seems like such a big topic, is why like the state implemented the AB 2083, which was referenced earlier. And even that sense is, the scope is children and families that are really being served actively by foster care. And we know that we have to go much broader. FFPSA, the Families First Prevention Services Act, goes a little bit broader, but it still is really those that are at imminent risk of foster care. And even that is still too narrowly focused. So, this is why the prevention symposium that, Rocio, you did, I think 4 of them, 3 or 4 of them, to really gather feedback from the community really needs to go that broader, that we all have some elements of this work and some responsibility, and how do we coordinate? Otherwise, we're still going to be kind of chasing an issue and feel like we're kind of one step behind.
We have a chat from Chris.
Yeah, I can actually, there's data that's on the publicly facing site that we can send out as the link, nor maybe to the CCWIP site that shows some of this that I think people can have, just because it's a really good site that shows each county and you can compare versus the statewide. And again, it's just a wealth of information.
I'll make sure that we bring back to the monthly meeting with our partnership with Valley Medical Center and CAC, kind of our overall data from DFCS. We can start having that as a regular report out. I'll check in with the bureau managers to bring that back too.
Aaron, you have your hand up.
Yeah, it's just kind of touching a little bit. I now work for the County Office of Education in partnership with Social Services, right, and supporting our youth and our social workers with all things education. But on a personal level, I still receive Amber's emails because my wife and I were foster parents for a while in the county. And I recently got to attend a meeting that was parent support group, but they, I don't know how often it's happened, but it was my first time experiencing a combination of the support group for bio parents, for lack of a better word, and foster parents. And I was so pleasantly surprised of how much mutual respect and admiration and love there really were. And I thought it was such a brave kind of avenue to go down that path of kind of combining these two worlds, right? That really are working hand in hand this whole time, but sometimes it's behind the scenes, or separation is kind of in place because of the systems and protocols and procedures. And it was just really neat to see that now at this, having this other role, working with foster youth. And I was so grateful that I continue to receive those emails from Amber. And and it helps me think of, we were talking about prevention, Daniel, but also a post involvement, right, support and services. And I just think that's awesome to remember that once we can get families, right, to kind of exit the system, that we continue to provide support. And it's awesome to see that.
Yeah, thank you. That's an incredible group of individuals to be part of. And I thought I saw Amber on. I don't want to put her on the spot, but if she had anything that she wanted to add, otherwise, I agree wholeheartedly with what you said.
Yeah, no, I saw her too, and that's what made me think of it. And I wanted to give her a big round of applause, but I don't know if she disappeared or not.
All right, so we've got 2 minutes left, and I want to make sure that Dan has a chance to do the wrap up, let you know what's coming up. So Ariel, if you could put the slide up, thank you. So Dan, you can go ahead and.
Yeah, thanks, Nora. So, and again, thanks everyone for making the time and for the really engagement and the really good questions. So our next continual learning will be August 30th. There'll be the survey, and I think they'll also include opportunity to ask any questions ahead of time. And I think that's really helpful so that we know if there are specific topics that we should be covering. So, we'll plan on providing some updates on some of the broader pieces that are happening within DFCS. But again, if there are specific topics that people are interested in, please let us know. And again, just appreciate the partnership as it's been kind of raised up several times. The work that we do, our staff do, I think, incredible work. It's very, very focused work. And I think that there's a broader need to expand kind of what supporting our community looks like. And it's really going to involve that ongoing communication and collaboration with all of us that are here. So again, just appreciate the opportunity to share what we're doing with you. And just hope everybody has a good rest of the day and a good rest of the week.
All right, and we are done. Thank you, everyone.
Thanks all.